Children with autism have some behavior difficulties that have engaged the attention of health workers, therapists, and other professionals in search for interventions. Today, available interventions include behavior plans, acupressure, diet, sound therapy, medication, among others. My name is Angel Aquabetino, a founder and a CEO of Listino Center for Children with Special Needs. The main focus of this center is to train parents so that they can naturally recover their children from autism disorder spectrum to become independent in future. In my previous podcast, Behaviour Intervention Plan (BIP) was named as one of the most successful treatment options available for children with autism spectrum disorder. Today, our discussions will be based on BIP. Most children with autism often have challenging behaviors. This is so because in most cases, they have difficulty communicating their needs and wants in an appropriate way. To help eliminate these challenging behaviors, we need to help the children meet their needs and wants in a very constructive way. One way of achieving this goal is to have a behavior intervention plan implemented for the children. Behavior intervention plan is a tool that outlines practical ways of dealing with challenging behavior that has been identified and assessed. It's important to note that each BIP must be practical, flexible, and unique to each child's circumstances. A well-created BIP can significantly reduce or even eliminate challenging behaviors in many children. Look at Phil, my autistic child. Look at how far he has been naturally recovered through the therapy. Prior to drawing an effective BIP, a functional behavior assessment, FBA, should be made to identify the root causes or the function of specific behavior of concern. During the FBA process, a professional assessor needs to evaluate contingencies responsible for behavior problems within a broader perspective of the child's home and school environment. For each problem behavior of the child, a professional assessor needs to identify what situations provoke the behavior and what happens during and after the behavior. A study of these records over a period of time will help identify the root causes to facilitate the choice of appropriate BIP to eliminate the root cause. A BIP could be very simple or elaborate. Any good BIP could have the following sections. The goal to be achieved. This represents a desired behavior that will replace the identified challenge. Proposed intervention or action to realize the goal. Persons responsible for implementing the intervention. Method that will be used to collect results. Example, observation. Criteria that will be used to determine whether an outcome achieves the set goal or otherwise. Timeline for the achievement of the overall goal set. Factors to consider to ensure a successful BIP include the following. Keep it as simple and straightforward as possible. The outlined measures should be concise, specific, and proactive. Work on the challenging behavior inside the home, and then move the child out into other environments to conquer those situations as well. Test every strategy before putting it in the behavior plan. Adopt a cooperative approach if several people are involved in a child's care. Tackle one or a few challenging behaviors at a time in order not to confuse the child. Commitment and consistency in the application of the plan.